If you've received a new Epi Pen auto-injector lately, you'll notice that we've made a few changes. It's still the same Epi Pen that you know. It contains the same drug and you should use it in the same way. It just now has a new easy-to-use design. The new Epi Pen auto-injector is designed to be user-friendly. In this section, we will learn how to identify the signs and symptoms of severe allergies and understand when to administer epinephrine auto-injectors. The most common symptoms of anaphylaxis are hives and welts. It is important to note that anaphylaxis can occur without hives.
Anaphylaxis is the term for a potentially life-threatening allergic reaction that some people have to foods like peanuts and shellfish, insect stings and bites, medicine, latex, or exercise. It is a severe allergic reaction that occurs when a person is exposed to an allergy-causing substance called an allergen. When the allergen enters the bloodstream, the body releases chemicals to protect itself from the allergen. Too much of these chemicals can cause a reaction in the body that in severe cases leads to potentially life-threatening symptoms. Anaphylaxis affects multiple parts of the body, such as the skin, upper respiratory system, including the mouth and nose, lower respiratory system, including the lungs, gastrointestinal system, including the stomach and intestines, and cardiovascular system. The most common symptoms of anaphylaxis are hives and welts. These symptoms are noticeable on the skin and are often present on the face, arms, hands, or chest. Other symptoms of anaphylaxis include swelling of the throat, lips, tongue, or the area around the eyes, difficulty breathing or swallowing, a metallic taste or itching in the mouth, sudden reddening in the face called flushing, itching or redness of the skin, abdominal cramps, nausea, vomiting, or diarrhea, increased heart rate, decreased blood pressure and accompanying paleness, a sudden feeling of weakness, anxiety or an overwhelming sense of doom, and collapse or loss of consciousness. It is important to understand that the symptoms of anaphylaxis can vary. A severe allergic reaction can occur with many or few symptoms, and each reaction can be different. In case of a severe allergic reaction, people with asthma are more susceptible to severe breathing problems. Therefore, it is especially important to follow your doctor's instructions on how to treat asthma. If you are uncertain about whether you are experiencing an asthma attack or an anaphylactic reaction, epinephrine should be used first. If you are at risk for anaphylaxis and think you have been exposed to an allergen and you experience any symptoms, an epinephrine auto-injector should be administered immediately. Allergy experts in Canada have agreed on the following key recommendations for what to do in the case of a severe allergic reaction. Epinephrine is the first-line medication that should be given to a person having a potentially life-threatening allergic reaction. Antihistamines and asthma medications must not be used as first-line treatment for an anaphylactic reaction. Any patient receiving emergency epinephrine must be transported to an emergency room immediately for evaluation and observation. Additional epinephrine must be available during transport to the emergency room. A second dose may be administered within 10 to 15 minutes or sooner after the first dose is given if symptoms have not improved. Individuals with anaphylaxis who are feeling faint or dizzy because of impending shock should lie down unless they are vomiting or experiencing severe respiratory distress. No person should be expected to be fully responsible for self-administration of an epinephrine auto-injector. For additional information about anaphylaxis and epinephrine auto-injectors, please talk with your doctor or pharmacist.
If you've received a new Epi Pen auto-injector lately, you'll notice that we've made a few changes. It's still the same Epi Pen that you know. It contains the same drug and you should use it in the same way. Review the section titled How to Use Epi Pen Auto-Injectors to ensure that you are up to date with the changes. It now has a new easy-to-use design. The new Epi Pen is designed to be user-friendly. In a previous section, we talked about examples of common triggers of anaphylactic reactions, which are food allergens, insect bites and stings, latex, prescription and non-prescription medications, and exercise. In some people, anaphylactic reactions happen without any obvious allergic trigger. This is known as idiopathic anaphylaxis. This section will go into more detail about the common triggers and give you useful tips on how to avoid them. It's set up as an interactive module so you can learn about the triggers that are important to you. Here's some general advice if you have a serious allergy, no matter what your specific triggers are. Avoiding the trigger is always the best strategy. We'll give you tips on how to stay away from your triggers. It's not always possible to completely avoid triggers. Be prepared by having adrenaline or epinephrine auto-injectors such as Epi Pens handy. For more info about Epi Pens and how to use them, please visit epipen.ca or please consult the consumer information leaflet in your product package for complete dosage and administration instructions. Carry a card with your important medical information in your wallet next to your ID where it's easy to find, and consider wearing a medical bracelet so that healthcare professionals will know about your allergy even if you can't tell them. Now please click on the appropriate module to learn about the triggers that matter to you.